And you're live. All right, good morning. This is Senate Health and Welfare, and it is Tuesday, April 1st. We're taking up H238 and then H91 with a walkthrough, and H91 may have a delay simply because it's on the floor in the House, so we're getting a leg up on it. And which means our Legend Council is also overseeing the presentation of that on the floor. I won't say that we're going to pass this bill out right away because that would be an April Fool's joke, but we do want to pass it out sooner than later. Commissioner Levine, thank you for being here, and we will just, you know everyone on the committee. So why don't we just go right ahead with your presentation? Great.
Thank you. So, Mark Levine, Commissioner of Health, and I'm here to testify regarding the health effects of the PFAS class of chemicals. And let's get right to it.
Okay, good. And we have this on our webpage, so we're good.
So this is not new news I'm delivering. This has been accumulated scientific evidence over many decades, and it's actually getting better all the time, and the evidence is getting stronger. As you know, we don't design clinical trials exposing humans to toxic substances and find out how many suffered and how many didn't. So we have to rely on animal studies, which are predominantly done in mice and rats, but there's actually a whole host of mammals that we have information from, including primates and dogs, and even cows, I believe. We also rely on epidemiologic evidence, meaning looking for associations of significant outcomes with exposure to the substance we're interested in. So in this case, it's very clear. There are many postulated health effects that are not on this slide, but the ones that are the clearest are on the slide. Increases in cholesterol levels. We all know the implications of elevations in cholesterol. Immune effects, predominantly on how we respond to vaccines. So does the human develop an adequate antibody response, which is what you give the vaccine for in the first place. Some significant pregnancy-associated effects, some of which can be more routine, like elevated blood pressure, some of which can be more extreme, like preeclampsia, where the gestating mother is actually suffering serious health consequences. Developmental effects, which can occur while in utero or actually after the time of birth in the postnatal period. But the most classic one is a change in birth weight. Others that could be included would be impacts on skeletal structure, things of that sort. And then, of course, cancer is always the top of most people's list when they're looking for what bad things can happen. In this case, there's a number of cancers that have been associated, but the strongest associations are for kidney and testicular. And just keep people apprised that the excretion route for PFAS, if they get in your body, is through the kidneys. Effects on liver enzymes. This is something that, the liver is your organ that detoxifies you. So things that come through your body end up at the liver level. So there can be an impact on liver function. And then endocrine effects, so hormonal effects, which thyroid and sex hormones lead the list. And in this case, I consider PFAS a little bit like what is now in the lay literature termed endocrine disruptors. So substances that get into our bodies and can have adverse effects, often on endocrine hormones and the glands that produce those hormones. So that's sort of the compendium of things. Obviously, we look at how much exposure someone has had, so the amount of exposure, the duration of time that exposure was over, the dose, and seeing if there's a dose response relationship, how often you're exposed. If it's in your well water, you're exposed presumably multiple times a day. If it's in a manufactured substance, you may only be exposed, periodically to it. And then what is the route of entry? So obviously the most powerful routes of entry are through your mouth and into your intestines. But there also can be impacts from breathing PFAS substances, and they can even be absorbed through the skin. But obviously the things that you ingest are the ones that are much, much worse. And then we look at individual factors, how healthy a person is in the first place, how healthy some of these organs are that help detoxify or excrete the substance, how sensitive a person may be. And then how much their health is impacted by access to healthcare and quality of healthcare, how much their drinking supply is impacted by being a more pure and healthy supply versus not. So this slide just illustrates that, we often think of these things as chronic, that accumulate in your body, and over time, you'll pay the price for that. And that's certainly an important thing, and that's how the cancers predominantly would evolve. But the acute is the thing I wanted to just point out. So a pregnant woman at a point in time during pregnancy, that can have a major impact on what goes on with the growth and development of their newborn. And there can be immune and developmental impacts early in life that are more acute exposure related than very chronic. So it's sort of true of all substances. We had to make a fairly big deal about that with PCBs in our high schools because people were often looking at just the very long-term effects, which are bad enough, but they have to realize there's also the acute effects. And these substances are just all, there's so many of them. So when people talk about regulation and things of that sort, there are thousands and thousands and thousands of chemicals that have this polyfluoroalkyl chemical sort of signature. Though there are some that are so much more common than the others, and those are the ones that we really have already got a structure in place in Vermont for, like PFOA or PFAS, etc. And then finally, you've heard the words for forever chemicals, and in this case, that really is true about the way they behave in the environment. Very hard to get them out of the environment once they're in it, which is why the focus of the bill that's in front of us is so important, because the focus of the bill is, by and large, preventing them from getting to the point where they're getting to the environment because they're no longer in the products that we use every day. These are man-made chemicals, so we have choices about their use in various products. They're also forever chemicals in people's bodies. It's quite well known that older individuals may be more susceptible because things have accumulated over time, and the rate of ability to excrete the substance is way less than what might be coming in or just sitting in their body. So very challenging. And approaches that prevent PFAS from entering the environment are critical for reducing these kinds of exposures and improving public health. So those are the main things I wanted to cover for you. I know that this bill that is being entertained lists some very specific new products, containers that contain fluorine products, dental floss, cleaning compounds. We feel that adding these to what already existed in previous legislation is fine. This is certainly more protective for public health, though we know there are challenges. every step of the way. So for that part, we have no major concern to talk about because we do believe they are extremely hazardous to health. So I'll stop there and see if there's questions.
I do have a question. Thank you for that. I think it's very helpful, and as we keep accumulating information about health effects. So this is terrific. But I do have a question about what's going to happen when NIH funding disappears, because this has been critical, and also what's going to happen with TSCA when there isn't adequate oversight at the federal level.
Well, I thought you probably asked me to weigh in on that too.
I am asking you to weigh in on that.
Yeah.
Yeah.
So I mean, just having things in TSCA is more helpful because there are so many thousands
of
compounds, and you've got to be able to get your hands around them and really deal with what you need. But now, our most recent experience with the EPA is, as of yesterday, one of our grants that dealt with environmental justice was abruptly stopped. And that wasn't a surprise. It was anticipated. We had a rather
word in it.
Yes.
Justice.
Right.
Why would we ever want justice?
And we had a subrecipient that had a rather large amount of money awarded to him. So fortunately had used much of it, thank goodness. But climate and health as a theme, workforce has already been released at the federal level. So that's not going to be a focus anymore, as we all know. EPA, to its credit, had done so much in the last year or two and took what Vermont and a limited number of other states had done very successfully, which is actually begin the process of setting limits on how much can be in our environment, setting levels for water supplies, etc. It's not going to reverse any of that, but Vermont was already planning and making all the right plans to adhere to even more strict levels that the EPA had actually come up with after much, much time and deliberation. We're very concerned that the EPA's focus on protecting the environment and the humans and other animals that live in it is shifting. And so
radically,
we don't know exactly where that's going to go. It wouldn't reverse if they abandon the new pathway they're on. It wouldn't reverse what we've already done in Vermont because we already came to a place that's protected compared to many other states. But it certainly wouldn't be encouraging this state, the region, or the country to be making more progress.
So the new limits that were suggested by EPA, they something that our regional consortium is looking at, or that we are looking at in our Department of Health?
Oh yeah, no, the new limits we already have.
We got it.
Yeah, well, I don't want to isolate it to the Department of Health because we're not the regular.
I understand that.
But DEC and the Agency of Natural Resources, for sure, and very nice roadmap. That's been published actually. Where we're going with that. But that was under sort of an assumption that the new EPA guidance was going to be the guidance of the land. We haven't been told it isn't. I'm just.
Is it still up on the webpage? I haven't looked at the EPA webpage recently, so.
I have not either.
Okay, well, it'll be interesting to see how that goes. Yes, and I know that Vermont has always taken leadership in this area, regardless of the chemical. And when I've talked with EPA representatives from our region, they've always been very encouraging about going ahead and demonstrating leadership. So maybe this bill will do it again. I don't know. I do have another question, and that is the bill actually, now there's a transition in moving some of the regulatory authority for PFAS over to ANR. And how is that working with DOH and DEC, ANR? How's that working?
That's actually fine.
It's fine.
That's fine.
It's not going to limit us in any way.
No, we've had a very strong working relationship with them. That's
Okay.
only improved over the 8 years I've been doing this, and we're fine with that. The Attorney General's office has a specific role in this as well, which is described,
Yeah.
and they will help describe. But we are the ones who bring health to the table, look at this through the health lens, work carefully with people as they set up the regulatory structures within DEC, but we actually don't play any role in that aspect of things.
And so then that does raise another issue, and that is the pesticide coated seeds and pesticides generally entering into the food chain. And so I know it's Agency of Ag, but it's everybody else. So has Department of Health been looking at that issue, maybe in collaboration with Agency of Ag or others?
Not, we'll have to get back to you.
Yeah, that would be
Because I have
helpful,
no doubt we
It-
haven't looked at it, but I'm not sure we've been very involved recently.
because it just sort of hangs out there as a little cloud.
Yeah,
And when we bring it in here, if we start talking about the health effects of these pesticides, then that's where it ends. And then it goes to the Ag Committee, and we're not interested in hurting our farmers. There's no question about that, but we are interested in limiting toxic chemicals from getting into a food chain that ultimately comes to us. Could be through little cows, but could be through other things.
yeah.
Yeah.
We will respond to that.
That would be helpful. Yeah, terrific. Thank you for that. And I know that there is now a health person in the health scientist in the Agency of Agriculture, but sometimes we see differences of opinion between that, the agency and other qualified experts. So I'm not putting this all on you
Oh, no, no.
necessarily, but it is a concern that I have. And I will share that concern with everyone.
Yes,
Yeah,
I'm happy to report that
okay,
we also have a really close working relationship with agriculture now.
okay,
Whether it's milk or whether it's maple syrup, both important for log products. We actually work together a lot on that. And now with the H5N1 issue and testing of the milk supply, making sure that if there are cases of avian influenza on farms or in the humans who work on those farms, we're all connected. We have a very tight relationship.
well, it'd be good if you could, that's helpful, and I'm glad for
And
that.
Triple E is also,
Yeah, yeah, no.
we have to monitor mosquito pools
right.
together for months and months and make important decisions about restricting people's lifestyles,
Yeah.
or at least recommending versus aerial or
Right.
ground spraying.
If you could just get back with some of the work or information regarding pesticides and work in that area, that would be very helpful. It is something I hear about consistently from constituents. It's a huge concern. But life is simple, right? Any questions, committee, on this? It sounds like you've got some support. We have support here from the bill. You've given us some
Yes,
really important background information on health effects, and that's what we're about in here. We appreciate it.
Yeah.
Okay,
yeah, there's nothing in the bill that we don't see.
good. Okay. If we banned all PFAS in the state, what would happen then? We'd have to come back.
Yeah, but
Yeah.
also it would take generations to see the levels in our environment disappear, though we would certainly have done a good deed to prevent new PFAS from here.
I actually haven't done my literature review on whether or not there are any engineered bacteria that can break down PFAS. Do we know if anything like that?
Actually, there is some.
There
yes,
is, okay.
Yeah,
Yeah, I haven't done that recently. Oh,
but that introduces a whole other issue.
It's a whole other thing, isn't it?
Mixing with the natural homeostasis.
And we don't, and we know that there's a program going on with Casella and Montpelier, and I don't know where that is to remove PFAS from, sludge septic. So your
Yeah.
Senator Cummings.
That was after I became an expert in municipal sludge.
Okay. Well, we might follow up with that, but I really appreciate your time and, we know now you're leaving.
End of this week.
Oh, it's very sad. Well, it's been a really great relationship to have you with our committee and to help inform us about the vast amount of work that we've done with the Department of Health and with you as commissioner. We really appreciate it. Just to let you know, COVID. Oh, my goodness. Yeah, can't even begin there.
Thank you.
Yeah, thank you. So Senator Gulick, are you still there?
I am, and I don't have any questions, but I would like to thank Dr. Levine for everything he's done for all of us in the state of Vermont. Thank you so much.
You said
Yeah. Thank you. Well, you're not done yet. We have a week left, so.
it. Still working.
All right, good. Thank you, Commissioner. We appreciate it.
I have a stick now with finance.
I know, you can say any county you like, except for this one. That's fine. Look at this one. So. We have Attorney General Charity Clark with us. You're such a crowd.
Hello. I keep bringing little cows.
Somebody has.
We don't know.
Yeah, we don't know.
Oh, you have a secret admirer?
It's a secret.
Wow.
This phantom cows are like phantom Valentines.
Oh, okay. I just turned up. I love that. Hello.
You know everyone around the table. I think we'll introduce.
I mean,
Senator Larry Hart.
probably because I like look you all up.
Right.
Hi, Senator.
Yeah. I used to get email after email to your office.
Okay.
Oh, for sure.
I think you know me, Senator Lane.
Yeah, of course.
She comes into institutional all the time.
Oh, well, that's good. She does, but well, different cohort.
Yeah.
Yeah.
Well, it's good to be here. I'm not sure that I've testified in this committee this year yet.
No, you have not.
So it's nice to be back. And on a bill that I really, really like. No surprises. I always really liked these bills to make sure that our environment is clean and our health is safe. And this one, sure, as Dr. Levine so nicely laid out, this would help in that direction. So generally, I'll just say that we are very supportive of the bill and don't think it's perfect. And let's make it better. We have a couple of,
Okay.
I just want to make a couple of notes of things that we support. And then there is like a recommendation for a change that I have that affects our office. So first, I just want to say the definition of intentionally added, which we've had this conversation before, but we really like because it clarified that if you add PFAS in the manufacturing process, you are subject to the ban. You know, you're so responsible for that PFAS that gets into the product, which is great. However, I wanted to make one suggestion regarding water, which is exempted from the language of intentionally added. So intentionally added definition at
What page are you?
we're page 3 of the bill that came over from the House.
Okay, well, let's
It's
get to that.
10 on
Eventually added is number 10. It's
Yeah.
on page 3. Yep, got it.
And the last sentence says, PFAS shall not be considered intentionally added if the chemical is present in the product due to use of water containing PFAS and the manufacturer took no action that resulted in the PFAS being present in the water. So if the manufacturer is dealing with water and there's PFAS in the water and needing to cause that PFAS to get into the water, they would be exempt. Well, I can see why we don't want to, punish the manufacturer, but that doesn't sound like. So they could just completely know their water is totally polluted and they're, be pumping it out of the well in Bennington. So we have an idea. what if instead of, and we can wordsmith this if you like this idea, what if instead of the phrase, is present in the product due to use of water containing PFAS, it connects that water to Vermont's drinking water standard. So as long as the PFAS in that water is within the drinking water standard, okay, exemption. Otherwise, no. So that's our idea there. I hope you like it.
So, yeah, so we'll have to figure out what.
Yeah, what the wording might look like, but I think that that's a nice standard.
Senator Douglas has a question.
My question is actually for Dr. Levine, if he's willing to answer. What sort of filtration methods are able to collect or catch PFAS out of water?
Yeah, so I can give a partial answer. I mean, there are carbon filtration methods that I know are used. DEC would be better
We'll find out.
person to ask. But on our webpage, we have a whole section on treatments of water. Right. And we can send you that, the link for that on the page.
Moving on to, so there's a provision towards the, let me change from the right page. Okay, this relates to, it's on page 10 and it's the fluorine treated containers. 2494G. So if you go down to sub D2, on
B is what?
D2 on page 11.
Yep.
So this and D1, this involves our office. Well, of course, this whole thing involves our office because we've used the Consumer Protection Act to create these regulations related to PFAS, which we love. It's great home for it. However, I'm a little bit nervous about this section. The end of the paragraph of D1, implied that we would be making a determination that the use of PFAS in the consumer product or in the container is a currently unavoidable use. And then it explains in sub 2 that a currently unavoidable use means that the use of PFAS is essential for health, safety, or the functioning of society, and for which an alternative is not reasonably available. So my office has mostly lawyers. We do have a few investigators, although I do have some in the consumer unit. We don't have any in environmental, so we don't actually have that level of expertise that I think this implies we would have. Happy to develop it. We do always do in our cases. We have to develop expertise, but I'm not sure this is going to be easy for us to implement in the way that it is now. So we have this legal expertise, but maybe this isn't the easiest fit for us. So I'm not sure, and I would defer to A&R because they do have the expertise if they have weighed in on this provision. I looked it up and see that the implementation date of this fluorine treated container section is 2027. So one solution might be to just push it out a little bit so that we can sort of figure out how to develop the expertise. We do work closely with A&R. They are a client, and maybe we can come up with something if you want us to look at this. But as it is, this part makes me a little uneasy.
So one of the questions we had was functioning of society, but it seemed like a fairly broad.
Yeah, and why is there this carve out? And again, not an expert, but when I looked up what these containers look like, they look like jugs that would carry chemicals or fluids or something. So I don't know why it's unavoidable. Like, can they not put them in another that have to be fluorine treated? I don't know, but
These aren't the liners in tomato cans, are they?
No,
Okay.
no. No,
Because I had that question. What are they?
yeah, so this is you've raised an issue that we heard about earlier. And
okay.
as we take testimony, we're gonna have to sort out what do these jugs look like? What do they use to carry? And what does unavoidable use mean?
Yeah, why would there, well, I assume it comes from somewhere, so that would be good to investigate and we can better understand too.
Don't know.
Yeah, what, so the flooring must do something so that's unavoidable, but maybe we can learn more and
I'm
then
not sure we know.
navigate, yeah.
Okay, that's a red flag for you, and it needs to have some capacity in your office to handle this,
Yeah,
to work collaboratively, continue to work
Yeah.
collaboratively with ANR.
yeah, something like that. So maybe we could dig a little and we will too. We'll learn more too, but
Yeah.
that was a flag. The last thing on my list, because I just can't resist, is we of course would prefer, although we appreciate, the dental floss. I've already made the switch. So if anyone needs my Charity Parks recommendation for PFAS-free dental floss, let me know.
Because I've finally been through with my husband's.
The Costco section, no, time. Oh my gosh.
Yeah, dental floss.
Yes, I have the same crisis. So now I've sprinkled those around my leg. So I have them in my car, the PFAS ones they're still there. and I need them.
They're
Dental
good
floss,
for
right?
sewing things.
They are good for sewing. They're very
You need really
strong.
And
Yes, they're very strong.
so.
So I do appreciate these products, but of course we like a broad-based consumer products ban. That's our preference, but totally excited about this bill. I can't resist just pointing that out.
Right, I know, and that's always been the tension, isn't it? Whether to do
Yeah.
it all at once or to pick and choose
Yeah.
consumer products.
Yeah, here we are. We've banned with this, if this bill passes, we will have banned many of the products that I so far can think of in my own life. Although maybe now that I have confessed, I'm not really sure what a fluorine lined container is. Maybe there's products I can't imagine, but I think we're making great progress. But of course, a broader ban would always be preferable.
I'm worried about Band-Aids. I'm not told that actually. PFAs
On your
are
open
wounds. But I don't know what's a not adhesive tape. Doesn't do a whole lot, but yeah, I mean.
Well,
what's
there
the
are some medical,
Band-Aid. Yeah, but I buy mine at the dollar store.
yeah. Yeah, there it is. They probably do everything.
Yeah, I feel like.
There are some medical things that, products that still have BPA in them, for example, but there's nothing else that is gonna make them, it's difficult. Any questions for the Attorney General on this? So the language about enforcement and your office being, involved in this is good with you.
Oh, yeah, oh, totally. I think this is the right spot. The Consumer Protection Act is the right spot for these PFAS bans. I think it works well. And the other piece that I have worried about, we're happy to work through whatever the committee would like, but wanted to flag that.
Well, language, if you have some suggestions regarding the rules piece and then the intentionally added piece, that would be really helpful.
Okay. Yep.
We'll sort it through as we go along. Yeah. Okay. Terrific. Any other questions?
Yeah.
We're good.
Thanks for having me.
Thank you for being here. Thanks for your work. This is really perfect. So we're gonna take a short break until Katie gets